Hi everyone, welcome to this podcast today, and I'm going to be talking about fascial manipulation and why, as a therapist practitioner, it will be really beneficial for you to learn this technique. I do have a special guest with me today, and I will introduce them to you in a moment. But before I do, I'm just going to give you a brief explanation of who I am. So my name is Sarah. I am a certified fascial manipulation specialist. I've had the privilege of training with Stecco. I became one of the first two in the UK to have this specialised certification. I specialise in women's health, so I do a lot of periods, fertility, IVF support, menopause problems, and other things as well. I'm also a traditional Chinese medicine acupuncturist and many other things. Now, the other thing about me you need to know is that I work with WIST, which is Women in Sports Therapy, and this is the Sisterhood of the Sports Therapy Association. We are a community of women that work in sports or other areas, and we're there to support one another. So this podcast today is to give you some support. I always get asked why and how you can progress your own journey in how you want to learn in women's health, and I think this is for you. So I'm super excited to introduce my guest to you today. Very pleased to have you here, Antonio Stecco, President of Fascial Manipulation Association. Welcome, Antonio. How are you today?
I'm pretty good. Thanks for the invitation. Always a pleasure for me to be here, to try to present a little bit of our material. So, thanks again for the invitation.
Oh, you're welcome. I'm so pleased. I know this is a very short notice, so we couldn't have anyone live with us today, but hopefully you'll get the information that you'll need by watching today. So I think the first thing to do would be for our listeners to actually understand what fascial manipulation is in case they've not heard of it. So would you kindly explain what it is?
So, fashion manipulation is a method that was invented, in before 1980. So it's more than 40 years that it's in place. It was invented by Luigi Stecco, by the way, my father, that it was really curious to understand how the continuity, how the fascia tissue that he was studying, he was dissecting at that time, it could influence the mechanics, and not just the mechanics but also the pathology like pain and so on. So fascia manipulation is based on the concept that the fascia is a structure that connects multiple body segments. Let's think about the fascia lata, crural fascia. They are in continuity. So what the tension is generated in the distal part of the leg is perceived proximally and vice versa. The same if you talk about the brachial fascia and the brachial fascia is a continuum. It's like a long gloves or a long socks. So this continuity facilitate the biomechanics, facilitate like the gesture, it give more leverage, so more power to our body. But at the same time, if something go wrong, can generate problem. It can generate compensation. So a problem in the ankle over time it will generate a problem in the knee, in the hip. So this is why, since the Greek, we talk about the rheuma, so a thing that move around. And that is most related to this anatomy, this sophisticated anatomy due to the fascia. So restore the gliding between fascia layer and between fascia and muscle will restore the biomechanics, so better range of motion, less irritation of the free nerve endings, a better recruitment of the underlying muscle, so better strength. So fascia manipulation teach how to assess the patient and how to detect, analyze this specific area in the body where lack of gliding can generate a major problem. So this is a fast track because we have codified specific area that we call center of coordination. So center where there is the coordination of the vector generated by the underlying muscle to perform the motion in the distal joint. So if this area there's a perfect gliding, patient move properly. If in this area there is a lack of gliding, that generates mechanical problem and pain.
Amazing. So I can remember when I did level 1 with you, which was, oh my goodness, I think it's about 9 years ago now. But I remember there was a guy that was a pilot, and he had a problem with his arm. And I remember that you did the treatment on his stomach. I can remember that very, very well.
Improve because the continuity is there. I mean, the pectoral fascia merge with the fascia of the oblique sternum, and the pectoral fascia is fully insert within the brachial fascia. So this continuity is well, presented, well, is easily visible during dissection. But of course, when you do the dissection, you have to know what you want to see. Because if you want to scratch and take away, and trash the fascia to see the muscle, of course, all this connection will be lost. But if you do a proper dissection layer by layer, you can see this amazing connection. And you can see how load is transmitted and how coordination in this sophisticated system can be done.
That's amazing. Yeah. So a lot of people are going to ask, and I get asked this quite a lot, with fascial manipulation, what is the difference between seeing someone that does fascial manipulation and seeing someone that does myofascial release?
Oh, I can talk about fascial manipulation. I can explain a little bit the principle and how this method works. So basically, between fascial layer and between muscle and fascia, there is a extracellular matrix, a lubricant that is mostly done by hyaluronic acid. So if this lubricant is in proper composition, it's like a piston in the cylinder. The piston move because there's oil and everything, the engine go well. But if the oil gets sticky, like viscous, you grip. The piston doesn't glide inside the cylinder. And so the engine can break. This is the same that happens in the fascia. Because if there is an increase of the viscosity of the loose connective tissue, of course, the fascia layer, the fascial muscle cannot glide. And so this generates a decrease of range of motion, irritation of the free nerve endings, and pain. So our is a method because at the end of the day, for us, it's important to understand which area of our body are not gliding properly and generate a poor biomechanics. For each patient we face, even if they have the same symptom, the combination of areas that are not gliding properly could be different. So the key part of this method is not how we treat, that is well known that we treat with our knuckle, with our elbow, specific area until we get reproduce the fluidity. But the key point is to define which combination of points has to be treated. Then the treatment can be done manually with your hand. It can be done with a shockwave. It can be done even with a needle. Okay, because we care that you reproduce the glide in that specific area. So the combination of the point that through a specific flow chart, a specific chart that we have, allow you to reach exactly what has to be done for that symptom in that specific patient. It is, I think, I make a little bit unique the method because we don't have protocol, but we have just guideline that help you to manage, many symptoms in a variety of patients.
Yeah, no, definitely, I would agree. And what I love about the format that you have created is that wherever you go in the world, everyone is doing the same format. And from your courses, I have grown such a massive amount of community that I can reach out to, where I have a patient and I send them, let's say, to Japan. I know that FM therapist will be treating them the way that I do the treatment because they'll be using the same method, which I think is also very, very unique. So it doesn't matter what part of the world you are, we all do the technique the same way.
We have more than 28,000 participants so far worldwide. Of course, not all of them are certified. You are very, very minimum part. Okay. And you are one of the first.
Yeah.
So the again, between these 28,000, just few of them, few hundred are certified because of course it's a long training. There's a many course, 4 level that has to be done plus an exam at the end. So this narrowed down the people that are able really to fully embrace the method, apply properly, and get the knowledge to pass the exam that is made by theory and practical part. So that is like our effort to get more and more people to the end of the career. And this is why now we have also a school that is 3 year part-time school that help to bring the people from the basic to the final, knowledge to, be excellent, fascial manipulation certified therapist. This is very important. We have like all the country. We have more than 60 countries where we are present. We have many different language. But as I said, it's still like a work in progress because this knowledge has to be shared with everybody.
And I mean, 28,000, that's incredible. Um, but I just want to talk very quickly. Now, I can't remember who it is, and I know that you're going to tell me, but I know you've done some training with some of the baseball teams, haven't you, in New York? Was it the Yankees or the who was it?
I just received another invitation today about the Texas Ranger. But if we can say, I mean, it's public because we're there. We go from the Dodgers to the Diamondbacks to the Chicago Cub to the National to the Atlanta Brave, New York Yankee, New York Mets. We in many more. So we have trained the healthcare team of a lot of. Not just baseball team, but a lot of sport team because whoever want to improve performance and decrease sport injury, okay, with this method you can at the beginning of the season analyze the player and figure out what is wrong, even if the symptom is not symptomatic yet, is not clinically appreciable. So this is possible because the assessment process that we have is based in strength, range of motion, okay, lack of proprioception. So there is a lot of signs that tell you that there is something wrong there that over time can become symptomatic. So this is why people that want to invest in prevention, they should know this assessment process, this method, because it can be like the easy way, the cheaper way to assess the player. We have now amazing gait analysis. I saw, something unbelievable about what they invest to try to figure out what is wrong in a player. But the skill of your hand, so like the ability to palpate the tissue in specific area with the knowledge of the anatomy behind is a value that cannot be, forget
Yeah,
for clinician.
yeah. No, I completely agree because it's not, I mean, when I get someone approach me, it's not until my hands physically go on them that I know what can be done. And when you start to feel the densification, sometimes, like you said, it can be silent. But that's really amazing. So it's moving in different directions now. So from a point of women's health, there's a huge movement of talking about menopause. It's been happening the last couple of years. And as mentioned, the WIST ladies that join us, they're always talking about how we can improve, which and FM would be fantastic for menopause. So things like frozen shoulder. Why do menopause women get frozen shoulder? What is behind the fascia? What's going on there?
So recent study have proven that the fascia have a receptor for estrogen, progesterone, and also testosterone. So it's mean that the fascia is sensitive to peak and fluctuation of the hormone. So this is why it seems from what we know so far that as menopause coming in, the fascia become more stiff. It loses adaptability because the mix of collagen change. Okay. On top of that, the aging make a decreasing amount of the elastin fiber in the fascia, so that make it more stiff. And on top, aging, in particular after 40, decrease the amount of hyaluronan in all our body. Think about wrinkle because there's less hyaluronan in the skin. But this is happening also at the fascial level. So put all these three elements together. When we get to 50, around 50, this will unfortunately facilitate the myofascial problem. So the what call like the 50 shoulder, as they call like in New
Yeah.
York a lot of time. This 50 shoulder is a combination of cofactor, maybe also grandkids. You don't really know what is like overuse. I want to say there's a combination of factors that are really strongly related to myofascial pain. Why? Because myofascial pain cannot be detected with a classical MRI, but we have now new MRI like T1 Raw that evaluate the quality of the loose connective tissue, and that can be a way to objectify this problem and clarify that the problem comes from the fascia.
Yeah, and it's definitely paramount that you can see that, like you said, from 50 onwards, the shoulder is just like 1 minute it's fine, the next minute it's not. And then we also have things like plantar fasciitis, which I've noticed that tends to rise up as well. And the same kind of problem with the, all the decline in the estrogen. Anything different with the plantar that you can think of?
So plantar fascia, I want to say it's like a borderline between a ligament, let's say, and a fascia, because most of the collagen fiber are longitudinal and mostly go from bone to bone. So many times the plantar fascia is just a manifestation of the exceed amount of tension that discharge in the heel, in the calcaneus. So if there is too much tension in the Achilles tendon, in the crural fascia that merge there, this symptom can be perceived at the plantar fascia area because that is where absorb a lot of load even from above. So in many time we don't even touch the plantar fascia, but we can fix what is perceived at the plantar fascia area. So this is one of the key point of the anatomy of the fascial system. So where there is the insertion, the periosteum or in another area, of course that is there where you perceive the pain. But the load discharge there can be generated by an incorrect gliding, more proximal, more distal. This is why it's fundamental to evaluate the body more globally and don't be focused only on the symptom, because most of the time the other symptom is the manifestation of the problem, not the origin of the problem.
Yeah, absolutely. Yeah. And you see that with other cases in clinic where someone's presenting with something. It's not always the case that that is where the problem is, which is the most important thing about, when you're identifying the fascia areas to work on. So for the WIST ladies that are watching, um, why would you recommend fascial manipulation for them to learn?
Fascial manipulation, as I said, is a method. It's help you to make assessment, make diagnosis, and of course, make treatment. So it's very valuable for this reason. So are you used to use the needle? Well, with the FM, you can better figure out what combination of air you should needle. You are a profession that works for exercise. Well, with this method, you can assess the body and better understand what area of the body is not working properly. Okay, and how maybe you can better organize your session. Okay, but of course, this can be like a excellent way where your hand can make the difference in a patient life, because I mean it would be endless number of times that the patient say, I this is the last resort, I already try everything, and you make the difference, you make really a big difference, because with your hand it's unbelievable what you can do. Okay, and a lot of times you do better surgery. I mean, you can really find out the area that make the symptom and take people out of opioid. Okay, so I mean it doesn't seem so important, the fascia, because it's not well studied in the university, but it's just a pity that for decades is was not taken in consideration. But if you go in the history, we have books of the 17th century, 18th century where fascia was well described in the textbook. But unfortunately, because over time people didn't give attention, it was not translated and was not present in actual books. But its situation is changing. It's changing finally, and there's more and more interest. Even US NIH is giving funding to talk about myofascial unit, myofascial pain. So, there's a rising interest on this. And again, you don't have to be the last to learn this material. You should be the first. So, this is the time to get this material and get in clinical practice all this knowledge.
I think you've hit the nail right on the head there, especially when with this treatment, you are the last person they come to because some people don't know much about it. However, what I've noticed in the last 2 to 3 years is that people are taking more accountability and they are actually researching more and they are finding out more about this treatment now and taking, their life in their own hands rather than, waiting and putting up with pain. So regardless of the courses, what is the criteria? Who can come and do your course?
I mean, physio, DC, DO, they're all welcome to come. MD first, okay. So we who have done like the 3 year of post high school education in anatomy, physiology, biomechanics with an active license to practice manual therapy, they're all welcome to come. Okay, this is criteria because worldwide we have judo therapists, we have like a different kind of healthcare professionals. Every country have a different regulation. But generally speaking, in the west part of the world, PT, DC, DO, MD are the person that normally fit our criteria. Okay, but we have also sport therapists that can have a license. Okay, athletic training, you ask if they have the license to do that. So this is our criteria, but of course, this is knowledge that needed for everybody. So this is why we give also webinar, online lecture, because everybody that face the body, they should know this anatomy, it is physiology. So we have a request from people that work for occupational therapists, people that work for our very segmental like speech therapists, because all of them they need to know this anatomy, physiology, and this pathophysiology as well. So it's knowledge that has to be shared with everybody.
Lovely. Okay, thank you. So I know that you're in London at the moment and you are teaching level one. I think there's another course coming up in October in Cambridge. I think there's one. And
Yeah,
yeah, and have you got any level twos or threes or fours planned for the UK?
I mean, in October, the 10th of October in Cambridge, there will be another level one. And then we will see what it will, grow up from there. I mean, we are willing to organize level two. Basically, we have done level two. We will do a master class soon here as well. We will, I mean, so level two was done last year. But as soon as we have another group, we will be more than happy to organize another level two for sure. And from there we will see level three that as well is something that is highly requested.
And can you please tell everyone where you're based in Italy?
So I mean, I'm faculty. I'm NYU faculty. So I was there, for a while before COVID. Now I can work a lot from remote. So I based in Padova, close to Venice. It's like a half an hour from Venice airport, and it's famous to be like the oldest university of medicine. And this was, a facilitation for us because we have books that is really 17th century, 18th century that talk about fascia and also about superficial fascia, not about deep fascias only. So that was a big advantage that helped us to, get into the topic and further, research that because, for instance, my sister is orthopedic surgeon, is associate professor in the department of anatomy, and she's carry on most of this research. So now we have a large group that are working on that, but we will looking forward to maybe have all of you. We have our annual congress that was just a couple weeks ago, like the first Saturday of June. We have our international congress, and that could be a good occasion to get a look, to have like some information about fashion manipulation, but fashion in general. So if you have the occasion to go through Venice, think about to step by.
It's an amazing area, and I've been to your studio, your I should say clinic. I've been there many years actually. I think it was in Tieni once when I went there, and then it eventually moved. But I loved going there. It's such a lovely place. And Padova, if I said that correctly, I'm always yeah, Padova. It's a really nice place to visit as well. Like you said, it's not far from Venice, and yeah, I loved going there. It was so nice. And you've got the winter school as well, so that's something that you guys have started up in the last few years. I came to yours, the last one just before COVID, but you're doing two a year? Is that right?
Video, the winter school in Padova is always sold out a year ahead. So, if you want to go next year, it's better that you go in the waiting list. And then we do the summer school. Next year will be in San Diego. Okay. And that time will be probably endorsed by the American Academy of Anatomy. So it will be a special event where a lot of anatomists will get together to, rise up the tension in the fascia. So that will be a special event. We did summer school last year in McGill University last year. So summer normally is in US, the winter school is always in Padua.
Yeah, and it is good. I mean, you learn so much. I came away from that. I mean, my mind was just blown. It was just such a good week. And yeah, definitely want to come back and do that again. It was but I'll have to go on the wait list. Okay, so lots of information to take on board. I will make sure that the websites, the Instagram, and your socials will be posted. I think that's it for today. I just want to say thank you so much, Antonio, for joining me and having a chat. It's been an absolute dream, and I really hope that it continues to take off in the UK. If anyone has got any questions, you can get in touch via the WIST. I'll put the details on there. If you want to know more about FM and you just want to get a bit more information, again, please approach us. We can always put you in touch with Antonio if you need to. But thank you very much, Antonio, for coming today. Everyone, have a wonderful day, and I really hope you've enjoyed the podcast. Take care. Bye bye.
Bye.